Hi everyone, my name is Toby Baker. I'd like to thank you for coming. I'll be the facilitator today. This is an educational forum about health insurance and the current problems that exist in our healthcare system. Today you'll have the chance to hear about these problems and, more importantly, share your own experiences. You'll have the opportunity to ask questions to decision makers and figure out what we can do to make change. Throughout the forum, please write down any comments, questions, concerns, or experiences you have. There will be an opportunity later today to share those. This forum was organized by the Jackson DSA, or Jackson Democratic Socialists of America, and with assistance of the Jackson Democratic co-chair, Amador Ybarra. We would also like to say thank you for the library to providing us this space and time. So your first mission of the day is to thank a library staff member or volunteer. They made this whole thing possible. Without further ado, let's introduce our speakers. Our first speaker tonight is Ayotte, who is the president of the MI Nurses Association, University of Michigan Professional Nurse Council, representing 7,000 nurses. She is a collaborative leader working to give a voice to the underserved and has helped with state and local legislators for the Safe Patient Care Act. She is active with various labor and health organizations like the HVALF, the DSA, the MNA, and the NNU. Cara is a Jackson native, currently living in Ann Arbor and working with Michigan Medicare. I'd like to introduce to the podium, Ayotte.
Thanks, Toby. Yeah, and like Toby said, I'm a Jackson native, so fun fact, I actually used to work at this library when I was in high school, and then when I was in college, I went to Jackson Community College for 2 years before I went to U of M, so I'm very familiar with this library, and I definitely should thank a library member. We work really hard, it's a beautiful facility and things like that. So, so obviously, we're here to talk about Medicare, Medicaid, and why cuts to that are very dangerous, and in general, how the system is kind of broken, right? So raise your hand. Obviously, small crowd, but raise your hand if you are familiar or know somebody who is on Medicare, Medicaid, or receiving that type of stuff. Yep. It's pretty much everybody here, right? Not to step on the other people's presentations, I'm going to talk about what that looks like from a nursing perspective and why Medicare for all or a single payer health system is something that would benefit everybody. So when you think about healthcare from a nursing lens, the current model, there's, I would say, 3 states. There's preventative, there's treatment, and then there's like palliative or supportive, right? And so when you look at it from those different lenses, like if you have difficulties accessing care from a prevention standpoint, so that would be dental care, eye care, making sure you're getting your vaccines, making sure your blood pressure is regulated, all of those preventative things so you're not in a state where you need to access surgeries or things like that, like more extensive health care. So if you have barriers to that, then you are coming into the health system already sick, already under-supported, already at an expensive need that you're not even getting at the baseline. So then when you're coming to receive care for that treatment model, maybe you're in advanced cancer or you have blood pressure that's gone unregulated for years. And now what that looks like when it could have just been a blood pressure pill or it could have just been regular diet and exercise, now that looks like maybe a longer surgery or an inpatient stay, or now you've had a heart attack because you had a cardiac condition that went undiagnosed for years. And so when we don't prevent, or when we have barriers to access of basic necessities and basic health care and preventative models, then when you are receiving care coming to the hospital where I work, that looks like long ER stays. That looks like a 4-hour surgery that's now a 12-hour surgery. That looks like an inpatient stay that could have been 1 day and now it's 6 days. Or worst case scenario, you never receive the care you need and then now you're, kind of like in your final days receiving care where it could have been preventable the whole time. So like cervical cancers or heart conditions where it started as a gum condition and now you have a septic situation and your heart is failing, all of those things. Start with access to preventative care. And then when you don't have that and you're coming now to receive care, your surgeries are longer, your outcomes are worse, the system is taxed, right? Nurses are working harder, doctors are working harder. Maybe it's difficult for you to find an inpatient bed because the hospital is overbooked with everybody else who didn't get preventative care. And then at that point in time, your healthcare providers are doing everything they can to support you and get you good outcomes and things like that. But in general, the system is overtaxed. And when it's overtaxed, That's when you see issues with, you know, length of stay, access after the fact, or providers maybe can't come see you soon enough, or delays in care and things like that. And then end goal, when you're in the palliative state, that would be supportive measures, so hospice care or access for our aging like family members who are now in care homes or things like that. And so when you look at the health model as a spectrum, if there's barriers to care along that way, you're going to get issues across the whole continuation of your life, right? So if you can't get health care when you're a young kid, or your children can't get health care, they're only going to have health disparities and poor outcomes as they continue to age, which is only going to make the problems worse because hospitals are overworked, we can't get access to that care, so then we're going to just continually overwork the system. Or if you have a break in access, then you can't get, you know, if you're on mental health medications, things like that, you can't get those mental health medications, you have poor outcomes, things like that. So from a healthcare lens and a healthcare provider perspective, Medicare for all is really something that would benefit all of us, and that's why cuts to Medicare, cuts to Medicaid are a danger to everybody. Because at the end of the day, everybody here knows somebody or is currently using those systems, and cuts to that means loss of your medications, loss of a provider that you can see. Like, using emergency departments as primary care models is not sustainable for our country and things like that. So from that lens, like, more support for these kinds of things is why nurses, healthcare providers, physicians across the country, various labor groups that I represent and work with support a single payer system or Medicare for all. And I think there are other people in this room who will speak on that as well, from a different lens. So people who've introduced bills or supported legislation related to that, people who've written books and other material, who's going to do a presentation about that. But in general, moving toward this model would only mean that, like, everybody gets care, everybody has access. There's been multiple studies and multiple surveys. We're going to share some of that data, looks like, later in this presentation, about how when we have these types of models like Medicare for all, everybody has access. There is no care delay. They're healthcare providers. You're seeing your healthcare providers regularly to prevent issues going forward. You have access when you do need treatment in case you do have a worse disease process. And then finally, you have supportive outcomes later in life if you should need those things, depending on disease processes or just the aging model in general. And so that's, I'm here to talk in that lens of why it's really important and why it's something we should all support. And then I'm gonna let Toby introduce Tim, but Tim's gonna also share a lot about that as well.
Thank you. So our next speaker tonight is Tim Faust. He is a national healthcare organizer, writer, and speaker. His 2019 book, Health Justice Now, examined the potential for Medicare for all in America and what a more expansive definition of healthcare could look like. He works as a healthcare coordinator in the Citizen Action of Wisconsin and has spent the last month talking with people about what Medicare means to them. I'd like to welcome to the podium Tim Faust.
Howdy, y'all. See if I can get this bad boy screwed in here. Oh, pretty please. There we go. Now that's... I have faith, I have a prayer. All right, whatever, I've got two hands. Thank y'all for coming out. My name is Timothy Faust. I live in Milwaukee. I'm the healthcare guy at Citizen Action of Wisconsin. For the past 15 years, largely, I've been working in and around healthcare, doing ACA organizing for Obamacare. I spent a lot of time driving around the country, talking to folks about what healthcare looks like in their part of the world. So I'm sure you guys know healthcare varies a lot from place to place, right? Healthcare needs in Jackson and healthcare needs in Detroit are very different from each other. Healthcare needs in Detroit, healthcare needs in Ann Arbor are very different from each other. Neighborhoods within Detroit can be worlds apart in healthcare outcomes and healthcare needs. And so getting to see what healthcare looks like on the ground in a bunch of different places is really helpful for understanding kind of the breadth of what we're up against. Now, I'm here to talk about Medicaid. Right now we're facing down the barrel of a bunch of cuts to Medicaid, which I want to talk through. Any of you guys here because you're concerned about Medicaid? Any of you guys ever been on Medicaid? I've been on Medicaid. Great. Let me talk about that for a second. I was on Medicaid. I'm one of the guys that got swine flu back in 2010. At least I think it was swine flu. Knocked me out, completely out of work. Couldn't work for 3 or 4 weeks. And I was making $12,800 that year. So not being able to work totally ruined my ability to pay rent. I had to take out loans from family to be able to just pay my basic bills. And on top of that, I got hit with a $200 hospital bill. You can't really treat swine flu, kind of like COVID, but even getting the basic checkup and some antibiotics took me out of commission. Couldn't pay my rent, defaulted to my credit card, almost ruined my life. And from then on, I swore I would never get health care ever again. As an oath, I followed for several years until 2013. One day, my roommate wakes me up, and I'm delusional. I'm not putting words together, I'm not making sense. I've got a really high temperature. So she rushes me to the hospital, but we learn I have a fever of 103.8, which for anybody who's not a doctor, is much higher than you usually want to have your temperature be. Turns out I had double pneumonia. I worked so hard I got pneumonia twice at the exact same time. And so they pumped me full of goo, and they swirl me into the ICU. I spend the night, I come out the next day, and they hit me with a $4,000 hospital bill. And I break down crying, because that's 1/3 of what I was making. That would totally ruin my entire ability to live. I mean, already as it was, I wasn't able to get an apartment under my own name until 2016, 2017, from that month I spent with swine flu. A $4,000 bill would have completely changed my life. And the receptionist at the hospital looks at me and says, well, okay, let's see if you're eligible to apply for Medi-Cal, the California Medicaid program. They just expanded their eligibility requirements under the ACA, so I now qualified. And so I got some paperwork, I went back to her, I enrolled, and my $4,000 bill dropped to $0. The only reason I have the life I have today is because of Medicaid. I've got plenty of folks across the country that have similar experiences. Here's a different one. I got a buddy named Steve who lives in East Rutherford, New Jersey. And Steve has muscular dystrophy. He weighs like 90 pounds, sopping wet. He's been in a wheelchair his entire life. His life expectancy was 18 or 19 years. He's currently 33, so every day is a gift. And Steve's mom had to leave the workforce when Steve was born because Steve needs a lot of home care. So she wasn't able to work, and so she had to leave. The income of the household fell in half while she was taking care of her family. And then one day, Steve qualified for and enrolled in Medicaid. And Medicaid pays for a home health worker to come over 40 hours a week, which isn't enough, and help take care of Steve's basic needs. Help him feed himself, go to the bathroom, clean, get around. And now Steve can work. Steve's a substitute teacher. Steve is an actor. He was on a Hulu TV show, Rami, if you ever saw that. He's having the more full and robust life which he deserves because of Medicaid. And because Steve can have a fuller and more robust life, and Steve is my friend, my life is fuller and more robust because of Medicaid. We're all kind of tied together with these little invisible webs, and Medicaid is the thing kind of keeping it together. And now they want to take it away. So these are scary times, right? I can't pretend that they're not. There are a lot of folks in this state and in this country who don't know if they're going to have health care at the end of the year. But the only way out is through, right? I don't think sitting around being scared in and of itself is very useful. You can't make things better if all you have to go off of are ghost stories. So here's what I'm thinking. For the next 15 minutes, unless I get chatty, I'm going to lay out the facts and give you the context of what's happening. And after that, we do Q&A, get to hear from the panel, and hear about how Medicaid affects other people and how it might shape the rest of your life. That sound good? Great, let's get cracking. Let's take it from the top. Congress wants to cut government spending by about $4 trillion over the next 10 years. This money will be turned into a handout to the super rich in the form of a massive tax cut. And to do that, they plan on hacking away at a bunch of things. The biggest target is Medicaid, which is a program that provides health insurance for low-income people. And these cuts are going to have consequences for everybody in this room, regardless of whether you use Medicaid or not. Health policy is one of those things that seems really complicated, a lot more complicated than it actually is. But here's what it all comes down to. Healthcare costs a lot of money. Healthcare costs a lot more money than anybody normal can pay for out of pocket, and costs increase a lot every year. However, most people don't need healthcare at the same time. In a given year, 50% of all healthcare costs come from 5% of the population. In disability activism, there's this phrase, temporarily able-bodied, and that's the truth. We're all temporarily able-bodied. We're all but temporarily healthy. That's a porous 5%. Some years you don't see a doctor at all, and some years you get bit by a raccoon or get cancer or give birth. and all of a sudden you're smack dab in the middle of that expensive 5%. So we have this thing called insurance. We all put some money into a pot, and when one of us gets sick, money from that big pot is used to pay for that health care. In America, we largely delegate the function of providing insurance to private companies like United Healthcare or Blue Cross Blue Shield. But the thing is, it's not profitable to sell insurance to sick people who need lots of health care and are very expensive, and it's not profitable to sell insurance to poor people who both tend to be sicker and can't afford to put a lot of money in the pot. So instead of excluding them entirely from healthcare, which is how things used to work, the government developed Medicare, which is a program for senior citizens, and Medicaid, which takes care of people who don't have a lot of money. Any of you guys on Medicare? Doesn't look like it. Oh, great, you don't look a day over 65, I never would have guessed.
I'll start May 1st.
Well, congratulations, I hope it's a smooth and easy transition.
Hope so too.
Medicare is a program that's funded and run entirely by the federal government. It's completely run out of Washington, D.C. Medicaid is a program that's funded by both the federal government and the state government. So it's up to the state government to run it. So Medicaid can look a lot different in different places. And here's what Medicaid looks like in Michigan. Medicaid is a big umbrella fund that contains a bunch of health insurance and health finance programs. In Michigan, the largest one is the Healthy Michigan Plan, which is an insurance program for low-income people between ages 19 and 64. Now, generally speaking, you gotta have a pretty low income to qualify for Medicaid. The actual limits are based on the size of your household, whether you're a parent or a kid, and some arbitrary rules based on the state that's setting them. Now, Michigan expanded Medicaid under the Affordable Care Act, so a household of 2 with no kids needs an income of under $29,000 a year to qualify, which is not a lot of money. Now, there are other Medicaid programs too. Medicaid covers nursing home care and home health care programs for seniors and people with disabilities. That's called MI Health, maybe My Health. I don't know how you guys say things. It covers comprehensive care like physical therapy and medical devices for little kids. That's called My Child. It's also the vehicle by which hospitals that treat large numbers of uninsured patients get enough money to stay afloat. Those are called disproportionate share hospital payments, or DSH payments. Medicaid is also the largest funder of mental health programs in the country, and it's one of the largest funders for rehab programs too. This is all just good financial sense. Money put into Medicaid improves health outcomes, prevents premature deaths, and because people can get the health care they need when they need it, reduces the likelihood of catastrophic medical costs. On top of being, I think, a moral imperative and a core function of government, through Medicaid, we spend money now to prevent spending more money or suffering worse outcomes later. And that's borne out in how people feel about it. 75% of Americans like Medicaid. And that includes 2/3 of conservatives. Because we all know, deep in your bones, that sickness makes you poor and poverty makes you sick. It kind of gets you both ways. If things fall in just the wrong way, a car accident today, even just a weird cough, it can ruin your life, and Medicaid's one of the few bulwarks against it. Now, 2.5 million Michiganders use Medicaid. The largest group of them altogether is children. About 950,000 kids use Medicaid. And there are some stats you'll probably hear a lot in the coming months. In Michigan, 1/4 of the total population uses Medicaid, which includes 2 in 5 children, over half of nursing home residents, almost half of people with disabilities, and 1 in 6 seniors on Medicare. In the Jackson area school district, 48% of children are on Medicaid. Michigan spent $22 billion on Medicaid last year. 75% of that, or almost $17 billion, came from federal funding. That's the money Congress is trying to cut. But you gotta keep in mind, that $22 billion isn't just thrown into the lake or set on fire. That money is turned into salaries, it's turned into county health programs. It's a massive driver of state and local economies. So when you cut that federal $17 billion, what does that mean? What are the consequences of cutting Medicaid? Well, first and foremost, people will lose their health insurance. That means they'll either rack up medical debt and go bankrupt, or avoid getting the health care they need, causing worse and more expensive problems down the road. Problems ultimately we all paid for in lost labor, jammed emergency rooms, and government-subsidized unpaid hospital care. Second, facilities that treat Medicaid patients will close. This means rural hospitals and clinics in poor neighborhoods where you have higher rates of Medicaid patients. Now, half of these facilities are already underwater, and in states with more restrictive Medicaid programs, rural hospitals close 4 times more often than in states with more generous Medicaid programs. This is stupid. This is barbarism. This is the unraveling of American healthcare. They're making us all suffer so they can punish people who already have a tough time getting by. Now, you might hear Trump or some other Republican claim that Medicaid cuts out their table, and that's not true. Either they think you're stupid or they're stupid themselves. A few weeks ago, Congress passed a budget resolution that directed the Energy and Commerce Committee to cut its 10-year spending by $880 billion. And it's true that Medicaid was not explicitly named. But one, they've been trying to cut Medicaid for decades, and at some point when someone tells you who they are, you gotta believe them. And two, the Congressional Budget Office, which is a nonpartisan government agency, kind of the king accounting nerds in Washington, looked at this resolution and concluded definitively that this target is impossible unless Medicaid is on the chopping block. Except for Medicare, if you cut literally every other program, energy and commerce overseas, you would still need to yank $600 billion from Medicaid to pay off the bill. Now, whenever Congress people admit that they do want to cut Medicaid, they claim they're targeting fraud, waste, and abuse, which is sort of a catchphrase used to encourage you not to think too hard about what they're doing. One thing they bring up is that they want to impose work requirements on Medicaid to root out the undeserving poor. But it turns out that virtually everybody on Medicaid who can work is working, either at a job or as a caregiver at home, or they're in school. You know, they've tried work requirements before in Arkansas, and the process of enforcing work requirements cost a lot more than those requirements saved in cut payments. And a lot of those cut benefits are from working people who can't keep up with the nonstop paperwork, right? Applying for Medicaid can be a very long, tedious process, lots of paperwork. Do that every month over and over again, and people fall through the cracks. The Robert Wood Johnson Foundation estimated that work requirements would kick 4.5 million people off Medicaid almost completely for procedural paperwork reasons. The thing is, Medicaid's one of the most efficient healthcare programs out there in terms of dollars spent to healthcare covered. Fraud's a pretty low percentage of it, lower than you see in private insurance. And when it's found, it's always private companies committing it, right? Rehab facilities charging for clients they didn't cover, administrative companies asking for money they don't use for care, and we have mechanisms for finding and preventing this kind of fraud. So if you want to cut fraud, you got to invest in the infrastructure that stops it. But a blanket Medicaid cut doesn't do any of that. If Congress cuts national Medicaid funding by $88 billion a year, just an across-the-board cut, one policy shop, KFF, estimates that this cut means Michigan would need to spend $2 billion extra a year just to keep things where they are now. Or you got to kick folks off Medicaid or pay physicians and hospitals less. And those are the breaks. There is no other option. No matter what policy language or accounting techniques you use, any cut to Medicaid is going to kick people off the program. And this is the choice Congress wants to force Michigan to make. Increase taxes, spend money they can't afford, or take away people's insurance. And before I let you go, let me tell you something I believe very deeply. Medicaid is one of the most visible, touchable, real-world ways that the government shapes your life. It's infrastructure. We think about infrastructure as things like bridges and hospitals and sewer systems, and those are all right, but healthcare programs like Medicaid are the social infrastructure of America. Whenever a pregnant mother working the double shift at a Dollar Tree gets a card that lets her go to the doctor to take care of her back pain, that's Medicaid. Whenever a dairy farm worker gets an inhaler in the mail to treat his kid's asthma, that's Medicaid. Whenever a guy in a wheelchair can live with his girlfriend in their apartment instead of being warehoused in a nursing home, that's Medicaid. So an attack on Medicaid is an attack on society, the whole arrangement of people and resources that make our lives worth living. So why would you attack society? Well, The people who want to hack away at Medicaid are doing it so they can give that money in a tax break to the billionaires who fund their campaigns. This is what it's always come down to. People who control almost $100 trillion, 300 times the cost of the entire NASA moon program, want another 4 trillion more. And Congress has decided that you and you and you and me are gonna pay for it. Now, I grew up Catholic. But like most people who grew up Catholic, I'm no longer Catholic. But every world religion I know explicitly condemns any person who prioritizes their own wealth over the well-being of others. For the Bible heads out there, Luke 12:14, life does not consist in an abundance of possessions. Or from Judaism, the Tanakh, the wicked in his pride persecutes the poor. Let them be taken in the devices they have imagined. Or Atakathor from the Quran, you are obsessed by greed for more and more, and you will be called to account for what you did with the gift of life. But these people, who can't even look God in the eyes, are the very same people whom our elected officials have decided matter more than you or me, and they must be stopped. We cannot let them dismantle the society we have built for ourselves. But we can't stop them tonight. It's too late. And we can't stop them tomorrow. The only way we can fight back began decades ago, when huge swaths of the country banded together to demand that America provide health insurance for people private companies can't make money off of. This is hardly a radical belief. We're discussing a simple principle of fairness, that someone with $5 and someone with $5 billion are equally worthy of the freedom to live safely in their own bodies. There's a universal constant I subscribe to, which is that my life is made better when your lives are made better. Your lives are made better when my life is made better. Our whole world is made richer when the people we love are able to get the health care they need. Our lives, our friendships, our neighborhoods, our communities, our whole fucking country is made brighter and more colorful when the people around us are given the little bit of extra help they might need to lead the dignified lives they deserve. And Medicaid is the essential healthcare infrastructure that makes it happen for 1/4 of the people in this state. And even still, it's not enough. Medicaid is necessary but insufficient to this task of freedom, of liberation, of health justice. This whole Medicaid debate exists. This whole political rationalization for these cuts is because we have decided that some people deserve health care and others do not. Which is why I insist to you that our obligation is not merely to defend Medicaid. It is to improve Medicaid. It is to expand Medicaid. It is to transcend the boundaries of the program and cover all America's people in a universal health care program like Medicare for all. And I will not rest until this country, which is so sweet to some and so cruel to so many others, seizes upon this unprecedented potential and covers all care for all people. You know, we're beset on all sides by these scenes of great cruelty, and it's hard to stay optimistic. But I remain hopeful. I have to. I've talked to thousands of people from big cities and small towns, black, white, and brown, sick and healthy, who maintain a vision of a gentler and more beautiful world for themselves, for their families, for people they don't know. Despite the news, ours are a people rich in compassion, and time again over the past 200 years, we have risen to stand shoulder to shoulder and demand that better world, to demand that freedom, which is rightfully ours, is returned to us. Now, the danger is imminent, and for many of us, it's already present. But I promise to you that through this solidarity, and only through this solidarity, a better world is possible. So when we leave here tonight, I hope to leave shoulder to shoulder with you all. Thank you very much.
Thank you. All right. Our next speaker is Gayla Ignacio. She is going to go over the data we received from a survey that we sent out before the forum. Thank you, Gayla.
I'm Gayla Ignacio. I am a local mental health therapist, and I do pediatric care with traumatized children. So 80 to 90% of my caseload are kids who've been in the foster system, are in the foster system, have been adopted, and are on Medicaid. So when the day the freeze went into effect, my heart stopped because that's my job. So if all of my kids lose Medicaid, I lose my job, and I would have to restructure, and I structured my entire practice around working with and meeting the needs of some of our most vulnerable people. And so this is near and dear to my heart. And instead, I did summarize, but instead of just saying things in my own words, I'm just going to read some of what the people were allowed to make statements for our survey. Some of you maybe have taken the survey, and just going to go through a little bit about what people had to say. So you're hearing from people in our community. So out of the people who answered, 25% were receiving Medicare. No one who is currently receiving Medicaid filled out the survey. 50% had private insurance through an employer, and 25% had private insurance that they had self-purchased. So the first question we asked was, have you experienced any difficulty in obtaining and or maintaining health insurance? There were a few, this was one of them, where there were quite a few responses, and then several where there weren't a great deal of response. So for this one person responded mainly on the education aspect. I know my employer offers health insurance, but I received a 400-page book to read through. I was also offered $170 per month. So understanding even what employer health insurance is about can be difficult. This one says, when I first became self-employed, I had to start purchasing my own health insurance. Before the Affordable Health Care Act, I had to pay $600 per month. For that amount, I was given 3 doctor's appointments. All were denied. The supervisor of Henry Ford Billing Department took on my claims and billed and rebilled in a variety of ways with different coding. Spent a great deal of time and effort. All 3 doctor's appointments were ultimately denied for baseless reasons. So the person was left paying cash. So they paid over $7,000 to an insurance company and got nothing in return for that year. So they went without health insurance for 2 years after that. Someone else said their private insurance is very expensive. Medicare for their spouse with SSDI has been better. Someone in the Ann Arbor School District said healthcare costs skyrocketed recently, monthly and premiums on available plans roughly doubled. New plans were offered that were cheaper in terms of monthly premiums, but more expensive in terms of the user's share of healthcare costs. People have had claims denied. That was one of the questions. Fortunately for the person who had their entire claim denied, they still had insurance through their parent because they were under 26. And so between the insurance through their employer and their parents' claim, they were able to get a lot of that covered. Over 80% of the respondents said that it's either somewhat difficult or very difficult to understand their healthcare coverage, what it means, what's available, how to understand it. I found this one really interesting. Have you ever delayed or avoided seeking medical care due to issues with health insurance coverage? Absolutely. This kind of made me sad. Getting sick is terrifying because of the enormous cost involved. I waited so long to take care of my gallbladder, I ended up with an internal organ infection and needed 2 surgeries. Was in the hospital for a week and lost income for missing work. Fortunately, the hospital worked to get the surgeries covered by Medicaid. If not for that, I would be bankrupt. It makes me sad to think that in our country, these are actual experiences of real people. My family members are on a high deductible plan. I've often foregone doctor visits for myself if I don't think the issue can be solved easily or at a low cost. Another one, thankfully, I have never had to avoid urgent medical care, but I have decided not to fill prescriptions after seeing the cost. After paying one expensive bill to a dermatologist, I reached the conclusion yearly checkups are not in my budget, despite a family history of melanoma. My whole life, I delayed updating the prescription of my eyeglasses because insurance only covered updates in contacts or glasses. Now the insurance doesn't even seem to cover that. And then someone else said they limit dental visits because of insurance cost. People reported that there are several offices in Jackson that don't accept their coverage. I know for most clinicians who do my kind of work, even if they see adults, they will only see about 20% of the people on Medicaid because Medicaid does pay a little bit less. And so, again, it's going with what can make a person more money. So that can be sometimes a reason why medical people won't take certain types of coverage. Another person said they don't always know if their provider's in network, and that can be hard to figure out. And even if you call and ask, you don't always understand or know what is cost effective. Family members being denied necessary medical treatment due to insurance restrictions, and that was a yes. Close family member with multiple chronic conditions has not had insurance provided by their employer. And so cost and limited coverage has caused a bunch of health problems. So the biggest challenges people face with current health insurance is education, affordability, covering the deductible being afraid Trump and Congress will cut funding, co-pays, trying to find insurance as a self-employed worker, the hours and hours we had to spend reviewing plans. In my house, we did a lot of this. Many teachers spend a lot of time helping colleagues and union siblings make hard choices. So really spending a great deal of time thinking about other countries that wouldn't have had to spend so much time if they had universal health care. Delayed billing and supplemental bills sometimes lead to double payment or overpayment temporarily, so it's taking money out of pocket right away, and it can take months to get sorted out. I have $5,000 in checks right now from Blue Cross Blue Shield that I can't cash because they're made out to a different business name. Although they have my business address and my NPI number, Medicaid has canceled, Blue Cross Blue Shield has canceled all those checks and reissued them to me, and they all came in again made out to that same other business name. So the problems with our health insurance industry are staggering. Having to stop work for any reason, even an accident, leading to the types of problems that you talked about, losing jobs, losing housing, cost jargon, network, not in network, not understanding the plan. Almost everybody said if they could make one change to healthcare, what would it be? It would be universal healthcare, lower cost, less confusion, Medicare for all, not making having health insurance have to be contingent on employment. So everybody seemed to be on the same page with that. And then the last question was one that asked, is there anything else that they would like to discuss? And one of the questions was, what can we do to protect Medicaid, Medicare, and the Affordable Health Care Act? And so I know that you guys and the next people are going to speak to that, and it's my understanding you're going to talk about the panel next, correct? Okay. I would like to mention 5 calls. Has anybody heard of 5 calls and or used it? So 5 calls is an app. It's really easy. You just look up 5 calls, you plug in your zip code. It will pop up your senator, your 2 senators and your congressman and their numbers. And it will also give a list of items that are currently needing to be called about. On average, for any congressman, and we're talking about at the national level, not our state people, but senators and congress people, if they get 11 or more calls on one issue, that cues them and they see that is significant. 11 calls, that's all it takes. And so you can pick one is public health care right now on the list, and you tap that one and there's a script. And you can go through and just read it off, or you can go through and see the key points and you can put it in your own words, and you tap, and almost everybody now, because there is a lot of phone calling, they are putting you straight to voicemail. So if you don't want to talk in person, you don't have to. You leave a voicemail. If you're really nervous about talking in person, call after hours, you're going to get their voicemail. But that's a really quick and easy way to keep up with what's happening right now, and to have a quick and easy way. You hear something on the news, Medicaid, oh man, I just want to tell somebody about that, boom. It takes 3 minutes, one minute or less for each call. So that is one answer to that ending question.
All right. The next portion of the forum is where the audience can ask questions and get answers from our panel member, Amador Ybarra. Just a few rules before I come to the forum. We'd like to keep speaking to under 3 minutes apiece. Does anyone out here have comments, questions, concerns, experiences? Yes.
I think we should let people know that our other guest declined this morning. Right, our other panel members?
Yes.
Yes.
And the reason why, if I can, real quick,
Yeah.
is because they're swamped in Lansing right now doing stuff to get through this week.
Okay.
That's why. It's legislative, they couldn't be here.
Yes. So we did have 2 panel members that called in this morning and said they couldn't make it. Carrie Reingans and Sue Schink. Both of them were originally planning to be here. We would like just to say, yes, they were swamped. So, it is understandable that they couldn't make it, but also, we are their constituents, right? We need representation. Democracy isn't voting every 2 years. It's organizing, showing up, letting them know the struggles that are currently going on. This is being recorded, so we will share this with them, and we will still like to hear their responses, and you're free to leave your information and hear back from what they have to say. All right. So a brief introduction of our panel member, Amador. He is the Jackson County Democratic Committee Chair. Amador is working with the Michigan State Representative, Carrie Reingans, and Michigan State Senator Sue Schink on the My Cares bill that would provide universal health care in Michigan. If you have any comments, questions, concerns about that, he's the one to go to. Does anyone have anything so far? All right.
I'll ask a question.
Yeah.
Where are you at in the process of that bill?
Well, the bill was introduced in 2023. Carrie Reingans authored and introduced the bill in 2023, and then it kind of didn't get any action.
But it died in
Still,
committee.
yeah, it kind of died in committee. However, there's still continued efforts, and she has several co-authors on this and sponsors of this bill, and it'll be reintroduced.
Mm-hmm.
It's a matter of continue it, and whether or not you see the numbers there, the plan is to continue to do it because it's a good, purposeful legislation that will do. It's basically the same thing that Medicare for All on the federal level is talking about for the state level. It's quite simply a state-based single-payer healthcare system that would provide universal coverage to all Michiganders without deductibles, co-insurance, co-pays, or caps on coverage amounts. So it's kind of the long game right now that they still have to continue to keep it on the forefront and keep it moving, keep talking about it, And the plan is that it will be introduced. Right now, with the situation we have in the legislature, is going to be difficult.
Yeah.
Simple as that.
Is there bipartisan support for it?
That's a good question.
Yeah.
I wish I knew specifically, and I don't, because it never got out of committee, so if there were, I don't know.
All right. So I have some questions right off the bat, and one that was asked earlier today. What can we do? Again, aside from voting twice a year, what can we do? How can we get involved?
One of the biggest things is Tim, correct?
Mm-hmm.
As you were speaking about, is do something. Is one of the biggest things is ask that question again for me, Toby.
Yeah. What can we do? How do we get involved?
Okay, so I think one of the best ways is to utilize the resource of 5 calls to make contact with your federal legislators, because those are the ones that are capitulating to the authoritarian assault on our democracy at the federal level. So the the federal reps, Tim Walberg, both of our senators, they need to hear from us to stand up against these acts. And utilizing 5 calls is a great way to do that. At the state level, also, there's information. I provided a little packet with the MI Care, Healthcare for All kind of guidelines, and then also the information on it. And I also brought a list of contact information for our state reps in this area in Jackson County, and then also state legislators. And then also reference to 5 calls. And there's another group called mivoter.org, and what that is that was developed and spearheaded by our good friends in Washtenaw County Democratic Party, and what they've done is put together a comprehensive database and a website where you can go in, enter your address, and it gives you, during an election cycle, it gives you candidate information for your specific municipality or your constituency that you're in. It tells you who's running for those offices. Also, like right now, they have opportunity for us to put our actions on there. So when we have like a rally or an event or something like, we just found out about this actually. This is just like this week they got this program up and running, so it's enhanced now. mivoter.org is enhanced so that we can post and share our events on there so that people can access them. You go and type in your address, it'll tell you who's going to be rallying at Wahlberg's office on, Thursday. It'll tell you, I know that in the near future there's going to be a International Workers' Day Memorial event on the 28th of this month, I think. I can't remember, but anyway. So that's kind of what we need to do is call and write our federal legislators and stay in contact with our state reps as well, state legislators, so we let them know, we let them hear what we need and what we would like them to do. And they can, the struggle is that at the state level, they can do some stuff with this, but this mess is being created at the federal level. That doesn't mean that we can't ask them to help, ask them to do what they're doing, to write legislation like this, to continue to keep it on the forefront.
Yeah, absolutely. So what does MyCares do? I know we know it's a universal healthcare platform, but like, what are its plans to introduce like better accessibility? I know education was a huge thing that we talked about today, with people just not knowing what plans are available. Does MyCares like have solutions like to the education aspect of health insurance?
Well, I know the mission, MyCare mission is just established to provide as a public good, comprehensive, affordable, high quality, publicly financed and publicly administered healthcare coverage for all residents of the state in a seamless and equitable manner regardless of income, asset. I'm not going to read this. So what does it cover? Is that what you're asking?
Yeah.
Okay.
What are its benefits?
Benefits including but not limited to all the following. You asked about education. They got primary care, preventative care, chronic acute. It's all over there on those things. Is education here? It doesn't say education. I'm looking at this list. Mental health services, prescription drugs, medical devices, dental care.
So it does cover
It's
like
got-
dental.
It's got a lot, yeah, dental.
Yeah.
Care, substance misuse disorder, reproductive health care, long-term care, laboratory services, gender transition, organ donation, treatment of autism, ambulance services, hospice care. So it literally has everything that you could fit into underneath the healthcare umbrella except education.
Can I take that for a second?
Yeah.
I think the issue with education that was brought up in the survey is not education like going to school, it's knowing how to use your insurance, right? When you have 4,000 like plans and each one has 4,000 pages, you gotta get educated in how to use it. If you have a program that covers all your care, you don't need a booklet. You don't need to pick 100 different plans. You don't need to be educated about how to navigate the nuances of private insurance. The problem is inherently solved in the structure of the bill. You just get the care that you need.
I got that. It does make sense, though, to have some kind of a navigational process through that. I think I've made a note to myself to make sure I share that with our two representatives that are working on this for sure, because it's important to be able to learn how to navigate through the hoops. I look at it personally, or in my experiences, as the clowns move the hoops. Whenever you deal with something where you have to get services or resources that there's otherwise obstructive barriers to, then the people that are in control of those and running the levers of those access to those opportunities and resources, they change up the routine or the requirements at certain different times through the step of the process. So you have to pay attention to it, and you have to be able to kind of learn how to navigate that. So that would be beneficial to be able to do that. Even if it was, that if my care is for all is that you need something, you need medical treatment, you get the treatment, and you don't have to worry about the cost of it. However, still there's going to be a learning curve of being able to get in this program.
Thank you. Do you have any final closing thoughts before we close?
I think the most important thing to do this is to find out, to learn ways that you're comfortable in reaching out to either your state legislators or your federal legislators or both, and to call on them to be accountable for making sure that we're protecting ourselves in this situation with the health care that's being removed from us, being taken. And do that and reach out and let them know at the state level and the federal level. It's important to get involved and make your voice heard, because as I said, that legislators, especially at the federal level, especially our federal legislator here in Congressional District 5, he's not going to listen to anybody unless we're loud enough. Not at all. Not at all.
Just to piggyback off that, so when we were lobbying for the Safe Patient Care Act at the state level, maybe you're familiar, similar situation, it got heard on the floor, died on the floor, right? And so it was a 3-part bill. One of those parts was ending mandatory overtime for nurses, right? So, a lot of times when you're calling your legislators trying to get them to support these bills or talk to their colleagues and constituents to support those bills, they're not nurses. They don't understand why mandatory overtime is a problem for nurses. So one of the staunch, not gonna pass it, was not interested. He was out of Kalamazoo, so one of my colleagues at a Kalamazoo hospital called him and said, let's just talk. She said, working 16 hours is dangerous no matter what profession you're in, right? And he owned a trucking service, or owned a trucking company, and she was talking to him and she said, imagine if one of your truck drivers was driving for 16 hours straight. You yourself would know that that's dangerous. You yourself would know that that's putting the driver and everybody else on the road at risk. And immediately he said, oh my gosh, I can't believe that I haven't already supported this bill. This is insane. Nobody should be working for more than 16 hours. And then he became our strongest supporter at the state level. Bipartisan bill, Republican, was against it from the jump, and then immediately changed teams and was like, we gotta pass this bill. We had the most support for the mandatory overtime bill. Did not pass, unfortunately, but he has already championed the plan to bring it back to the floor, and he's going to lead that charge rather than somebody who's affiliated with the nursing association or things like that. And he took that on just from one conversation. So I think like it's really important to call your local legislators, your federal legislators, because the day-to-day stories and those impacts are what's going to make this change.
I can tell you all we're doing in Wisconsin right now, at least with my organization, which is with the caveat that I don't trust elected officials, even the good ones. I don't trust them. We've put a lot of work into finding people for any given issue on healthcare. You find the folks who are most directly affected. But for this policy, if this policy had existed, my life would look differently this way, or because this policy exists, my life looks like this, so on and so forth. And you gather them, and you gather around them, and you gather behind them. And emailing is fine, calls are pretty good, showing up to the office and getting in their face, politely, but firmly, with people who can talk about the direct consequences of bills. Is a good first step. And you don't do that and then go home and say, hey, we just talked to the rep, the day is saved. You continue to build that. We're having people throw house parties throughout rural Wisconsin where they talk about Medicaid and other healthcare issues. You can self-educate, you can call in, you have to keep building more and more people. And if you want like a tangible, active thing to do that like does move a lever, yeah, you can bring folks to the district office and you can shove them in the face of the 22-year-old dork who's behind the desk or whatever. And that's good. You should do these things. These things are worthwhile. But it's one part of a broader strategy to build more popular action. I'm a little bit cooler on strikes than, or it's not strikes, I love strikes. I'm a little bit cooler on protests than some others, like that can be energizing, it does turn on people. It's a lot of education, dissemination, broadening beyond these same 30 folks that go to all your events time in, time out. Healthcare is great because I have not spoken to a person in the entire country, conservative, liberal, socialist, I haven't talked to people that are fascists, but you know what I mean, who haven't dealt with feeling like they're getting fucked over by their healthcare. This is the one thing I talk about with strangers at bars, and it works every single time. This is a gateway issue for a lot of people to be brought into your cause, and it's important to take advantage of that, right? Not since 2018, 2019 with Medicare for All have we had such a clear, like, displayed value proposition. Medicaid is one of those things where it's kind of hard to recognize, sometimes even if you're on Medicaid, because it's got different names in different places. People might not know that Healthy Michigan Plan equals Medicaid. Wisconsin, that's Badger Care. When people find out about that, and they're saying, oh, your health care is being taken from you, or people you love, to give this asshole $4 billion, like, there has not been as naked an act of class war as we've seen without the guns in a very long time. And seizing on that is critical. People understand this. People understand being fucked over. And this is, I think, the best chance we've had. I don't think we're gonna like win socialism tomorrow off this thing. Fuck no. We got a lot of work to do. But this is, I think, the best activation tool for getting folks aboard for the long haul. So it's important not to waste it. So find the directly affected, go to them, put them in front of the line, march them to the office, and then spread. Do talks. Spread things like these. Talk to your neighbors. Talk to your friends. You can email me. I'll give you a bunch of flyers you can print off. That are cool looking. I downloaded the Canva free trial and I learned how to use it. But this is a unifying issue and it's you gotta seize it.
Thank you.
Hey, Toby.
Yep.
I always have to look this word up, but there's a thing called the illusory truth effect and in psychology. And it's the tendency, if you hear something over and over again repeatedly, regardless whether it's truth, especially if it's a lie, to believe it is true. Which is we can take a page from the Trump playbook, and we can call and call and call our representatives because they're not immune to that same effect. If they hear it over and over and over again, we want Medicaid, we want Medicaid, we want universal health care, we want universal health care. If enough of us call and keep calling, it will have an impact with some people. Like, just going along with, the stories are a wonderful way to make, to make that connection too, but just that repeated bombardment and not letting them off the hook.
Yeah, and that's, like, again, that's the main thing we talked about today is All right, well, there is stuff to do. You can make your 5 calls. You can go to myvoter.org. You can look at the events. You can see like who your representatives are, and it only takes a minute a call. It does not take much. We went over the nurse's perspective on like what's going on in the hospitals, working 16-hour shifts or more than that. In most cases, and the challenges they face. We went over cuts to Medicaid and Medicare from the federal government and what that might look like, how that affects society, and like the interpersonal relationships in our community, the people we know. Again, 1 in 4 residents in Michigan are on Medicaid. But you can do things to keep these systems active. You can make those 5 calls. You can go to myvoter.org, and you can just follow up. But I'd like to thank everyone for coming out and wish you all have a nice day. Thank you. Don't forget to thank a library staff volunteer member.